From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
Hey, welcome to Medical Forum. I'm your host, Jeff Reed. I want to thank our sponsor, At Your Service Home Care. Today, honored to have two guests here from Colonial Family Practice, Dr. Clay Louder, Dr. Chris Marr, owners of Colonial Family Practice. Guys, thanks for coming.
How you doing, Jeff?
Great.
Thanks for having us.
Not at all. I'll tell you, probably everyone knows of Colonial Family Practice. We've known each other forever, Clay, and been around business, but maybe bring everybody in a little bit. When did you get started? How did you get started? You're a farmer, and now you're a doctor, so please bring us in. Let us know.
Woo, I'm glad I'm not a farmer anymore. I grew up in that hot sun in Sumter, and I always kind of knew when I was young I wanted to be a doctor and came back home. I was born and raised here, and so it was nice to be able to come back home. And I think it just started from there. I think my wife and I have so many family members here. It got me busy to start with, and then here we are 19 years later. We started in 96.
Wow.
And now we have, just a wide array of healthcare services in Sumter. And I hope it's helped the community as much as it's helped me and my family. We love Sumter, and we continue to invest in it, and so we love everything about it.
Well, that's tremendous. Now, Dr. Marr, you joined the practice. Bring us up to speed on your background just a touch. You're not a Sumterite.
I am not from Sumter.
Okay.
I'm originally from Maryland, trained in Pennsylvania. And I was brought to Sumter, and I did a little bit of service to the National Health Service Corps, which brought me to Sumter. I worked for a family health center for 2 years. And I was getting ready to leave Sumter, and Clay called me while I was working in the emergency room, moonlighting, and said, I'm going to make you an offer you can't refuse. And so I joined Clay in 2007 with Dr. Ike Stewart, and we've been working together with Clay and Colonial Family Medicine since then.
Well, just a little background. I started with Merle Smith, and I started Reliable Medical back in 1998, and you've helped us so much, and we're still going in the community, so we're proud of that. But your business is taking off. I mean, there's just no doubt you're the biggest doctor's practice here in town. How many physicians now? I know of two. How many now do you have worth you?
We have a total of 28 providers. We have 18 medical doctors, and then we have around 10 physician's assistants or nurse practitioners. And what I'm proud of the most, it's not just a Sumter boy, that came back home. We got people like he said from Maryland. We got somebody, of course, that pulls for Louisville. We got a guy
Dr.
from
Whaley, Wake Forest guy.
Wake Forest. We even got a South Carolina guy, one, and then we got Penn State, we got Harvard. So a real diverse group of physicians. So whatever fits your taste in a medical doctor, I think we got it covered in a wide array of medical education and backgrounds, and I'm real proud of that, to have that in Sumter.
Well, that's going to be one of the topics, one of the few topics that we cover today. Give us your locations. Now, we know in Sumter, but when you say Sumter, where all are you located in Sumter? And remember, we've got a lot of viewers from Manning. And I know you're down there.
Thank you. Yeah, we do. We have our main, what we call the mothership, is 325 Broad Street. That's where most of our doctors practice, and our urgent care runs out of there. We're open every day of the week, including Saturday, Sunday. We're open after hours in case you need to come, after you've gotten off work. Chris Marr practices down the street on Broad Street. What's your address number?
We're on 220 Broad Street. We're open on Monday through Friday. We have late hours on Tuesday night until 7 o'clock. There's three of us there, doctors, myself, Dr. Judy, and Dr. Stewart. And there's always someone available to see you there.
That's right. And then we have a location really right by Swan Lake on Liberty, and that's our pediatric location, Colonial Pediatrics, and that's done really well. We have an Colonial Eye Center, which is located on Boltman.
Right on Boltman.
Right.
That's right.
Right. And then we have Colonial Neurology. The only neurologist in Sumter, Dr. Baker, is out. We just renovated the Black Tie building, which I think is great for Sumter to get that area going again. It kind of sat for a while, and he is excellent, board certified, Duke neurologist, and
we'll talk about him a little bit in detail later. I think also your sleep studies tied back there too, isn't it?
Correct. We have our sleep lab there, and we have Colonial Aesthetics there. We have a couple other locations where we run our billing out of, and other services in Sumter. We have a location, as you mentioned, in Manning, and we're real proud of that. And then Charlotte Greco runs our weight loss and some nurse practitioner medicine out of our location, really on the corner of Westmark and Alice.
That's right across from the Toomey outpatient, correct?
Correct.
Let me ask you, I was just scanning the website, and we've known each other a long time, and I know your philosophy, there's been two philosophies I think that you've carried, and if you can just kind of let people know what they mean. The first one was improve the quality of life, and if you can just elaborate on what does that mean, Clay?
Well, what it means to me is, the best example I can tell you, Jeff, is I saved my dad's life with a stress test. And my dad wouldn't be here if I hadn't have done that test, and it's using cutting-edge technology to prevent illness. Rather than, in the old days, you went to the doctor when you were sick. Now we want you to go to the doctor when you're well and prevent being sick.
That's great.
Catch it early, and let's do something about it so the quality is there.
That's tremendous. And a great hurdle with Medicare, I tell people Medicare is, for the most part, I think a very good advice for an insurance, but they're not much on prevention, and they're getting a lot better. And I think we'll talk about that in one of the next segments about the wellness checkups. The other, we will see you today. And I know that it's very frustrating. Chris, if you can maybe give a response to that, we will see you today. Very frustrating. I know the hospital, when a patient leaves and then they can't get with the physician, or you call the physician and say, yeah, we'll see you in 2 months.
I hear stories all the time about patients calling to their doctor's office saying they're not feeling well, and they get an appointment for 2 or 3 weeks out. Well, that's not going to help them that day. That's not going to help them get better. That's not going to help them resolve the illness they have. That patient's going to end up in a emergency room, and we will see them today. We cover for each other. There are plenty of physicians. We see each other's patients, whatever it takes to get that patient in that day. We have urgent care that's Monday through Friday, 8 to 8, and Saturday and Sunday, 7:30 to 6. Patients have all the opportunity in the world to be seen the day they start feeling poorly.
That's great. So we're here today with our medical forum highlighting Colonial Family Practice. And we're going to get into about 4 or 5 different segments during this time. But if you could, Clay, give us the rundown one more time. How can we get in touch with you? What phone number? Give us the, we'll call it the hub station of the address where the pharmacy and such are located in your office. So the phone number, please.
803-773-5227, and it'll get you to any doctor at any location.
And Dr. Marr, your location, phone number?
220 Broad Street, 773-5227.
Man, I appreciate it. And we'll be right back after this first break, and we'll talk about the pharmacy. We'll talk about neurology. We'll talk about some of the free wellness clinics that Medicare have out there for us. So we'll be back after this break.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
For some, in-home assistance is temporary while recovering from surgery, injury, or welcoming a new family arrival. For others, however, it's the beginning of a new path. It's often an overwhelming path of confusion, gaps in service, and questions when a family finds out Medicare doesn't pay for extended nursing home, assisted living, or in-home care. At Your Service Home Care is owned by Sumter Physicians and medical equipment providers. They have combined their expertise in healthcare and medical equipment together with specialists in the fields of in-home care, home health and hospice support, insurance, and attorneys. This team stands as the link between what a family needs needs and how to find resources to make it happen. At Your Service Home Care has the knowledge to provide in-home care and beyond. But it's much more than a sitting service. It's the one call for a family to have concierge service, steward, and guide to create and implement a game plan for the care of a loved one right now and for the days ahead. To discover your path to the finest in home health care, call At Your Service today at 803-607-9677 or visit them at 1250 Wilson Hall Road today. Find them online at www.ays-homecare.com.
As a referee, I pay attention for a living.
While I'm busy watching the game, I need your help keeping an eye on the stands.
If you see something that doesn't look quite right, tell a law enforcement official.
We all play an important role in protecting our communities, and you can help.
If you see something suspicious, say something to local authorities.
If you see something, say something is used with permission by the New York Metropolitan Transportation Authority.
Owning a firearm is both a right and responsibility, and keeping your firearms out of the hands of criminals is a special concern. Last year, 38 guns were stolen from cars and homes in the city of Sumter. This is Joey Duggan reminding you to do your part as responsible gun owners. Help keep firearms out of the hands of criminals. Locking your vehicles in storage compartments if leaving a gun in your car, never leaving firearms in your vehicle overnight, and storing all firearms securely in your home. For additional information on firearm safety, contact the Sumter Police Department's Crime Prevention Unit at 436-2723.
This is Medical Forum, presented by At Your Service Home Care.
Hey, welcome back to Medical Forum. I'm your host, Jeff Reed. We are visited today with Colonial Family Practice, two owners, Dr. Clay Louder, Dr. Chris Marr. And guys, when we left the last break, we kind of went over how we all got here and Clay being in practice here 19 years and all your locations. But let's talk about those services. Let me open up to you. Tell us about the services that we either know or don't know about. What do you want to tee off with right now?
Well, I tell you, we're really, really proud of our cardiovascular work. As you know, that's the number one killer in the nation by far. I mean, your risk of dying is heart. So we've really got the best, I think, technologists for those areas. We got a cutting-edge, state-of-the-art nuclear camera for nuclear stress test. I am convinced that everybody around here needs to be ruled out for cardiac disease.
Well, tell me, nuclear stress test. Tell me about how I get an appointment. Tell me what happens. Tell me how much time frame, and tell me what that entails, and tell me what it details.
Right. It's a lot simpler than you think. We do 8 or 10 a day, so they're very safe. You get an appointment by going to see your doctor, make an appointment, and discuss your heart risk stratification, which includes cholesterol and blood pressure and family history. But for the most part, you just come walk on a treadmill. It's really simple. We give you some medication. The simplest way is to think of it as dye. It goes to the arteries in your heart. Then we stress your heart by walking you on a treadmill. If you can't walk, we can use another medicine to stress your heart rate out. And then we put you on an imaging machine to see if you got possible blockage. Jeff, you wouldn't believe the people that we find that have heart disease that come back the next week and just hug us and said, oh, my gosh, you saved my life or my family member's life. And we're most proud. We also do echoes, which are ultrasounds of the heart to look for pump disorders or valve disorders. We also do ultrasounds of the neck and carotids. The big arteries in the neck are often blocked around Sumter and surrounding areas. So we're really proud of that, and just make an appointment with your doctor, and he can get you treated for that.
What age did you recommend? Is this something now that people in their 30s are doing? Or is it more, hey, like a colonoscopy, which we may talk about later here, we're recommended 45 to 50? Is this kind of...
It's usually over 50. It really is, but I tell you, we do see some heart attacks in some younger age men, and so we do tend to look at your risk, develop a risk strategy. We're doing some new things with blood tests that I'll tell you later about.
Sure.
But for now, just 50 and above usually for that.
Gotcha. Dr. Marr, name another service that is probably not known that happens here in Sumter in your office.
Well, one of the services that we've added recently, we haven't added the service, we've upgraded the service recently, is our sleep lab. A sleep study is a test used to rule out obstructive sleep apnea, very prevalent in the population. Sleep apnea is associated with being overweight, and again, obesity is a real problem in the population today. And again, we're finding a lot of patients with obstructive sleep apnea. We have redone our sleep lab. It's over on Wilson Hall Road. We have 4 brand new sleep rooms. Patients have said that these sleep rooms are much nicer than the old ones, a lot quieter, which is easier to sleep in, which is obviously very important. And again, treating obstructive sleep apnea is so important because sleep apnea can lead to uncontrolled hypertension, congestive heart failure. And getting patients treated with CPAP or CPAP-like devices helps patients combat these symptoms. And once the sleep study's done, we titrate them and get them set up for a CPAP device, and that gets addressed at one of our DME companies in town, oftentimes Reliable Medical.
Oh, yes. Oh, yes. Thank you. Yes. No, y'all are wonderful with that, and we see that as a major problem at Reliable Medical with CPAPs and BiPAP. And there might be some confusion. If you could maybe clear that up just a little bit, if somebody comes in a CPAP and BiPAP in this very simplest form, either one of you.
Well, CPAP provides pressure in the airway to maintain the airway to be open. BiPAP provides 2 different sets of pressure, and BiPAP is typically used for a little bit more complicated or severe case of sleep apnea, as well as some other medical conditions.
I gotcha. Stroke seems to be something that we talk about a lot in the South. Dr. Louder, is that something that you see very, very often? And do some of these tests help prevent that as well?
Oh, man, yeah. It's so common. I even saw a guy this morning that just had a recent stroke and was otherwise healthy. Very common along the I-20 belt, especially in Sumter. Same risk factors, really, as the heart we talked about earlier. A lot of times we do MRIs in our office, and I'm proud to say we just ordered a brand new 1.5 Tesla MRI, and it is cutting-edge, state-of-the-art. We're going to put that in our neurology office. We do a lot of MRIs on people and find that they've had little tiny strokes. Well,
TIAs.
Exactly. That's
Gotcha.
an emergency. That's an emergency because as physicians, we take that so serious because we don't want you to have a major stroke. You need about 4 or 5 medications to block major stroke once you've been diagnosed with a minor. So that's one thing that's really hits home, because if you have a stroke and you're in the nursing home, we really just let your quality of life go down. So we take that very seriously. And y'all, if I could encourage anyone that's had any kind of a stroke, they need to change therapy. Get on one of we usually recommend a statin medicine for cholesterol, an ACE inhibitor for blood pressure. Whether you have cholesterol, blood pressure or not, those medicines are magical at prevention. There's some new blood thinners on the market which are remarkably safe, better than you hear in the advertising, safe, and we think they make a remarkable difference in the recurrence of stroke.
Fantastic. We talked about CPAP and we've talked about stroke, and now we've talked about heart. Neurology you brought up. And I know you're really proud of Dr. Baker.
Right.
Such. I was looking at the website. People, I think, when they hear neurology, what is that? So rather than a layman like me who can read on the internet, neurologist. Who would see a neurologist and what type of symptoms? And if we could just briefly bring that in, we'll take a commercial break shortly and then maybe come back to that, because I think this is a big thing that I want to stress to people. But Dr. Marr, if you could kind of bring us into this break with a little bit.
Neurology is a very specialized subset of internal medicine. Neurologists treat very specific types of problems. Stroke, for instance. Oftentimes our stroke patients are seen by the neurologist just to make sure every T is crossed and every I is dotted. But more importantly, a lot of conditions that require very specialized care, for example, multiple sclerosis, require neurology care. In the past, we've had to send these patients to Charleston. We've had to send them to Columbia. And that's tough. That's tough for patients who have to follow up with these physicians regularly and make these trips to these cities. Dr. Baker has had quite an impact on several of my patients. Patients who were, again, seen in these tertiary care facilities, and has done a great job with my patients.
Well, and correct me if I'm wrong, and when we come back from break, we'll continue on that. You got the only one. Is that right? So in our listening audience, we have one, and that's Colonial Family Practice. So when we come back from our break, we'll have Dr. Lauder, Dr. Marr continue discussing Colonial Family Practice. We'll be right back.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports. WDXY 1240 AM and 105.9 FM.
For some, in-home assistance is temporary while recovering from surgery, injury, or welcoming a new family arrival. For others, however, it's the beginning of a new path. It's often an overwhelming path of confusion, gaps in service, and questions when a family finds out Medicare doesn't pay for extended nursing home, assisted living, or in-home care. At Your Service Home Care is owned by Sumter Physicians and medical equipment providers. They have combined their expertise in healthcare and medical equipment together with specialists in the fields of in-home care, home health and hospice support, insurance, and attorneys. This team stands as the link between what a family needs and how to find resources to make it happen. At Your Service Home Care has the knowledge to provide in-home care and beyond. But it's much more than a sitting service. It's the one call for a family to have concierge service, steward, and guide to create and implement a game plan for the care of a loved one right now and for the days ahead. To discover your path to the finest in home health care, call At Your Service today at 803-607-9677 or visit them at 1250 Wilson Hall Road today. Find them online at www.ays-homecare.com.
America had just gone to war when Felipe Adams volunteered.
I took a bullet to the side and left me paralyzed.
For Armando de la Rosa, the Navy was a chance to serve and see the world.
I got medically discharged in 2001.
For injured veterans like Felipe Adams, there are veterans like Armando de la Rosa ready to help.
Our training is to better the veteran.
Paralyzed Veterans of America, changing lives, building futures. Visit PVA.org.
This is Meryl Streep. There's so much in life we can't control. But here's something we can: colorectal cancer. It's the second leading cancer killer in the U.S., but it is almost entirely preventable. Screening finds polyps so they can be removed before they turn into cancer. If you're over 50, get screened for colorectal cancer. Screening saves lives. It could really save your life. For more information, call 1-800-CDC-INFO.
A message from the U.S. Department of Health and Human Services.
This is Medical Forum, presented by At Your Service Home Care.
Welcome back to Medical Forum. We appreciate everybody listening on a Saturday morning. And also want to remind you, if you're catching part of the show or missing the show and want to hear this broadcast, we'll be on Sunday, a rebroadcast of the same show with Dr. Lauder, Dr. Marr, and Colonial on Sunday from 2 to 3. So we appreciate you listening in. When we left, we were talking about neurology, Dr. Lauder. I think Dr. Marr kind of brought us into the beginning of it. Please take it from here and elaborate and tell us all the things that Dr. Baker does.
Oh, man, we're just really lucky to have Dr. Baker in Sumter. It's pretty rare to have a neurologist that can talk NASCAR.
I like that.
And he can. He loves it. He loves South Carolina and NASCAR. And we just love having a down-to-earth neurologist that's Duke-trained in Sumter. And he's not only open to our practice, he's open to anybody in Sumter that needs him with a referral from their doctor. And he is just an excellent physician. His services are wide range over there. We're putting in a brand-new 1.5, as I said, MRI, which is the best you can get. We're adding VNG, which is really a dizzy test for everybody out there. It tests whether you have vertigo or not and helps us to make some decisions on some rehab.
Mm-hmm.
You know, when you get older, your big risk is fall. Big risk is fall, especially if you have weak bones and
osteoporosis. Look out!
It's everywhere.
If you fall.
It's everywhere, and so we're always looking for fall risk. And we've developed a rehab program with our hospital here to do some rehab for that, and that's worked out great. Chris, you want to talk about some of the other things we offer there?
Dr. Baker does nerve conduction studies and EMG studies, which are studies often used to determine if there's any type of nerve damage anywhere in the body, the legs, the arms. The nerve damage can come from the neck or the low back. And oftentimes those nerve studies can help guide therapy, and Dr. Baker will do them right in his office. Dr. Baker also performs EEG, which is evaluating the electrical discharge from the brain. It's used to diagnose and treat seizure patients. Again, Dr. Baker has a load of seizure patients and takes good care of them. And a lot of those patients were, again, being seen in Charleston and Columbia and having to drive an hour or two to follow up with their neurologist, and now they're driving 10 minutes down the road to see Dr. Baker. The VNG test that we do for dizziness, we've really implemented that to screen a lot of our elderly patients. Elderly patients who sustain a hip fracture, believe it or not, Jeff, 33% of those patients will end up in a nursing home in a year. And 15 to 25% of them will die in a year.
It's
from
one of the most
fracture.
Amazing stats.
And you don't think there's any association with that, but there's a huge association with an elderly patient falling, breaking their hip, and then ending up either dying or in a nursing home, skilled facility.
We see it all the time with equipment. When I see a broken hip, it's especially when you see someone that already, like you said, has problems and now in their 90s and such. It's amazing statistically, the downfall, and it's a quick spiral.
It is. So one of the things that we've done to try to prevent these hip fractures is our balance program. And we have a simple test. It looks like a bathroom scale you stand on, and it's quick, takes about 30 seconds, and tells us, is your balance good or is your balance bad? If the balance is good, then we just follow them. But we're screening for those. We're trying to find those patients who are at high risk for hip fracture. If the screening test is positive and there's a problem with balance, we have other testing to determine the cause of the instability. And again, like Clay said, we have set up this program with Toomey Hospital Rehab. They have physical therapists who do nothing but balance all day. These therapists, all they see is patients who have balance problems. They work on walking, they work on balancing, and again, preventing those hip fractures, which are such a huge problem.
The one thing I'm taking from this is that the preventative medicine at Colonial Family Practice, if you see us ahead of this, we can prevent, using your father as the example, a lot of these problems. So the medicine and the tests that you have and the machinery that you have can help prevent a lot of these. It's very difficult, though, once that bell rings, though, isn't it, to fix someone who, like you mentioned with the TIAs, to immediately get them on the medication to prevent the stroke. But once the stroke has happened, it's tough to recoup. Is that a fair statement?
Excellent. Yeah, Jeff. We're preventers. That's what we say to ourselves all day long is, all right, come on, let me prevent something in this patient and make a difference in their life. And so every single piece of equipment we have is geared towards that at Colonial.
That's fantastic.
Which is pretty cool. I think a lot of us went into family medicine because of that. I think people go into medicine for a lot of different reasons. And I think there's a lot of specialties. Their job is to fix. Their job is to fix problems. Our job, most of the time, is to prevent the problem from ever happening.
Well, I think in the past it was just to diagnose and say, hey, here we found out what's wrong. What I like about what you guys are saying is you're taking the technology that's been afforded to have, and now we're preventing it. Rather than 25, 30 years ago, I think it was you went to the doctor when you were sick, as you said, and then they told you what was wrong, and sometimes said, now I'm sorry, there's nothing we can do for you. You're seeing healthy people and anticipating these could be problems down the line. Let's jump them while they're small and keep them from being large. Is that kind of where we're at?
Absolutely.
I think that's fantastic. Tell me one more in this segment, something else that you want to convey that's out there from the many things that we do at Colonial Family.
Well, another thing that we have at our office that we put in last year is our pharmacy. And I've been real pleased with that so far. It's very convenient. A lot of people can just call ahead of time, and while they're there for their visit, they go ahead and get their medications filled.
I'll give you a quick plug. I love them because, number one, it's the least expensive pharmacy that I've ever gotten. So thank you for that. Number two, because I am a client, a patient of yours, the information's already in there. So I don't have to stand in line and reiterate and fill out and do all of that. And your staff is excellent.
Well,
they're very polite. They are organized. And my son has a particular prescription that nobody else had in town.
Good.
And you said, well, it'll be here tomorrow. And so I appreciate that from a personal standpoint. But
that's exactly it, Jeff. And we were frustrated with that whole system. And we love to have the convenience. And there's a big push in medicine toward quality, making sure you're getting it right. As you know, there's been tons of reports of medical errors. This is one way to help, is we have instant communication with our pharmacist, and that they can communicate with their doctor. If we have a drug interaction or have a potential problem or a medication that's special for somebody, we go out of our way to get it. And I really will plug our staff. They're nice and friendly and warm, and thank you for that compliment.
Isn't it great to have the backbone there? Tell you what, we'll be back with our next segment. Again, you're listening to Medical Forum. We'll be right back.
Back with more on Medical Forum, presented by At Your Service Home Care.
For some, in-home assistance is temporary while recovering from surgery, injury, or welcoming a new family arrival. For others, however, it's the beginning of a new path. It's often an overwhelming path of confusion, gaps in service, and questions when a family finds out Medicare doesn't pay for extended nursing home, assisted living, or in-home care. At Your Service Home Care is owned by Sumter Physicians and medical equipment providers. They have combined their expertise in healthcare and medical equipment together with specialists in the fields of in-home care, home health and hospice support, insurance, and attorneys. This team stands as the link between what a family needs and how to find resources to make it happen. At Your Service Home Care has the knowledge to provide in-home care and beyond. But it's much more than a sitting service. It's the one call for a family to have concierge service, steward, and guide to create and implement a game plan for the care of a loved one right now and for the days ahead. To discover your path to the finest in home health care, call At Your Service today at 803-607-9677 or visit them at 1250 Wilson Hall Road today. Find them online at www.ays-homecare.com.
Are you always looking for places to stop and rest because you're short of breath, wheezing, or coughing? Who wants to live like that? See your doctor for a simple breathing test to find out if it's COPD, a serious lung disease. With treatment, soon you could be living more and stopping less. Visit copd.nhlbi.nih.gov. A message from the U.S. Department of Health and Human Services.
I was visiting my elderly aunt and her phone rang.
Oh, it's you again? But I already have life insurance.
The caller was doing a great job keeping my aunt on the line.
My credit card number? Hold on.
Well, when I picked up the phone and said hello, the caller hung up.
McGruff the Crime Dog here. Recognizing fraud can be difficult for older people. The National Crime Prevention Council wants you to know how to spot a scam and report it to local law enforcement agencies.
Learn more at ncpc.org/seniors. A message from the National Crime Prevention Council and the U.S. Department of Justice.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
And we're back with Medical Forum. This is our fourth segment of the day. I'm your host, Jeff Reed, here with two major physicians with Colonial Family Practice. The owners, Clay Louder and Dr. Chris Marr. And we have covered a lot of how we got started in Colonial Family Practice. We talked about the pharmacy, neurology. And now let's talk about this Colonial Aesthetics. Now, I know that's been around for at least 8 to 10 years, and but you keep adapting more and more and more to that, and helping with people with diabetes and weight loss. So if you could elaborate, give us, what is Colonial Aesthetics?
Nancy Hunter Blandon had this dream years ago to become an esthetician, where she improves the quality of your life by helping your look. You look good, you feel good. All kind of studies, and you look good, Jeff.
Oh, thank you, Dr. Louder.
So she has just done a remarkable job. She goes every year for education and learns a new technique We just moved her out to the Black Tie building there, so I encourage everybody to go check her out and see her services. She's got an online presence as well. And she does a lot of Botox injections for wrinkles. Of course, we're in the South and we're in the sun too much, and she'll do that. They do a lot of vein treatments for legs. They do laser hair removal. We have the best laser available for that. It's simple 5-minute procedure, and it really helps people improve their whole morale. It just seems like
it's true. If you look good, you feel good, right? So, right. And I've known Nancy, and she's obviously using her own medicine, right?
That's right.
She looks great.
She's got to sell.
Yeah.
She's got to sell.
Yeah.
And the most exciting thing I have ever seen is in the area of weight loss. There's a new product called Cool Sculpting that we're offering now, and it's a vacuum-type device that actually goes, say, around your midsection. It suctions up a big kind of glob or layer of fat, and then it freezes it for 1 hour. And unbelievable results. In about an hour, you can get what a plastic surgeon would do through liposuction.
Wow.
And then it melts the fat away. Now, it takes a month or two. It's not instant, but it's essentially painless. It lasts an hour. You walk away in an hour, and you can
go back to work.
Go back to work. There's no downtime. There's no risk of surgery. And her results are phenomenal. If you want to see something, go by her office and look at some pictures of some guys who's had some cool sculpting.
So guys do this. This isn't just girls, right?
Oh, man, the guys love it for their abs. I did it about a year ago, and I've kept the weight off ever since, and so I've been really pleased with the service.
That's fantastic. Now, all right, so this is not a surgery. This isn't liposuction. This is go in, spend an hour. You described it, freezing kind of where the fat.
Correct.
And go back to work.
Correct.
Now what happens? Do we have multiple treatments? Does it depend on what your desired results are or what you start with as far as your weight?
No, the weight, it doesn't matter. It depends on what you want for your body. Of course, most people want their midsection because as we get older,
right,
that's where we tend to hold on to it. Some ladies have done the back. There's some actual bra fat, which I didn't even know what that meant until they showed me how they could kind of freeze that away. But the results are of nothing short of miraculous on what it can do in safety. Safety-wise, it's completely safe.
And there's no time in the hospital. There's no recovery time. The mother who has this done is picking her kids up from school that day.
Wow.
Driving her kids to school the next day. There's no downtime. There's no downtime. It is amazing. It's truly amazing.
What else happened? I know that with makeup, and you mentioned not liposuction, but excuse me, with Botox and such. What other? If someone was to come in there, is this some place where they could go get their makeup, massage?
Oh yeah, well, it's a full spa. You need to go, Jeff.
I do need to go.
Loosen you up a little bit.
I've been writing these things down. This is not for the show. This is for me now.
But she does a great job of taking the tension out your day, getting something nice done for you or yourself. Guys out there, if you want to do something for your wife, go by there and get a gift certificate and say, hey, honey, I love you. Just thinking about you. I wanted to give you a gift certificate for this, and I promise you it'll help you.
It'll help you. Well, I need all the help I can get. No, thank you. What else? Tell us another topic that you want to cover with, because we were talking about weight loss, and some of this has to do with weight loss. But in my office, I see diabetes after diabetes after diabetes, and the number one culprit. You've told me this for 19 years. If you are heavy, the risk factors they've got to quadruple at best.
Absolutely. Obesity, being overweight is a real problem in society today. And a lot of disease stems from being overweight, diabetes, hypertension, coronary disease, heart disease, high cholesterol. There's been some remarkable advancements made in weight loss in the last several years. In the past, we were stuck with a couple of medications that just didn't work that great. They had some good instant results, but very little results that showed any maintaining of weight loss. But there's been some advancements in weight loss medication the last several years. Some medications that are actually studied for a little bit longer term. They show safety. There's at this point no concern for cardiac disease associated with the use of these medications. So again, some real good advancements. And again, these medications are good, but they're paired with a holistic approach to weight loss. We counsel our patients. We talk to them about the need for daily exercise, the need for healthy lifestyle, including calorie-restricted diets. We do have calorie-restricted diet programs if a patient wants those, one of which is the HCG diet. The HCG diet has been around since the 1950s. It's had a bunch of studies done.
What is that for the layman out there like myself?
The HCG diet is a very low-calorie diet. It consists of about eating 600 calories a day. And then the patient is supplemented with a hormone called HCG, and it can be given via injection. There are sublingual drops that can go under the tongue that you can use, and that medication has been used to kind of curb the appetite to allow the patient to maintain that low-calorie diet. I was really skeptical of this HCG diet, but I'm going to tell you, I've had some patients who were really refractory. They had been on multiple diets. They had been on Atkins and South Beach and all these diets and just were unsuccessful. And I can tell you, I have one patient in my practice, unsuccessful on multiple diets. She had actually was driving down to MUSC at their medical weight loss program, was unsuccessful. She has lost 35 pounds on HCG. So, I mean, it works. It works. It's a tough diet, but it works. And for patients who are highly motivated, they will lose weight. They will do well on it. And then we can come in after they've completed that first part of their weight loss and use some other therapies to help maintain the weight.
Well, it's such a problem. Some people have noticed two buildings being erected here in Sumter. One in my old building down just from you guys on Broad Street, and then over behind the YMCA. And they are both I can't think of the word, dialysis center, excuse me. And that's from not heeding this preventative maintenance advice and weight problems and such. So we'll be right back with our last segment. Appreciate the information, guys. All right, be right back.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
For some, in-home assistance is temporary while recovering from surgery, injury, or welcoming a new family arrival. For others, however, it's the beginning of a new path. It's often an overwhelming path of confusion, gaps in service, and questions when a family finds out Medicare doesn't pay for extended nursing home, assisted living, or in-home care. At Your Service Home Care is owned by Sumter Physicians and medical equipment providers. They have combined their expertise in healthcare and medical equipment together with specialists in the fields of in-home care, home health and hospice support, insurance, and attorneys. This team stands as the link between what a family needs and how to find resources to make it happen. At Your Service Home Care has the knowledge to provide in-home care and beyond. But it's much more than a sitting service. It's the one call for a family to have concierge service, steward, and guide to create and implement a game plan for the care of a loved one right now and for the days ahead. To discover your path to the finest in home health care, call At Your Service today at 803-607-9677 or visit them at 1250 Wilson Hall Road today. Find them online at www.ays-homecare.com.
Life can hit you with the unexpected. The loss of a job, a sudden illness, a dramatic jump in your mortgage payment, leaving you feeling helpless. If you've fallen behind on your mortgage, it's time to take control. You don't have to lose your home. The National Foundation for Credit Counseling can help. Call us at 866-687-6322 or visit mortgagehelpnow.org. Real solutions for real people.
NFCC member agencies are approved by the U.S. Department of Housing and Urban Development.
Almost half of all traffic deaths in South Carolina are alcohol-related. Hi, I'm Trooper Scott Edgeworth with the South Carolina Highway Patrol. 1 out of 3 Americans will be involved in an impaired driving collision in their lifetime. That means you or someone you love. Make your plans before you take that first drink. Be aware that most drunk driving collisions occur at night or during the early morning hours. And always remember, your best defense against any drunk driver in any collision is your safety belt. Always buckle up. Remember, sober or slammer, you drink and drive, you lose. This message is brought to you by the South Carolina Highway Patrol.
This is Medical Forum, presented by At Your Service Home Care.
Hey, and now we're back with Medical Forum. Just a quick reminder, this show will also re-air on Sundays from 2 to 3. And we're here with Colonial Family Practice. And when we left the last segment, we were talking about, I think, as important as any diagnosis that we see here in the South, and that was diabetes. And Dr. Louder, we left off with you on that, and I'd love for you to follow up and just kind of give us a little 30 seconds more on diabetes and what you would like to emphasize to people.
Yeah, thanks. Diabetes is just epidemic in Sumter, and it's getting worse. Our diets are really bad. We thought low fat was going to be the answer. Time Magazine came out a month or two ago and said maybe it's low carb. Very difficult. I'd encourage you to go see your doctor about your weight. We treat it as a medical condition. If your weight goes down, your diabetic risk goes down, as well as your diabetes sugars get better. All our doctors are trained in weight, and they want to help you lose weight and use the technology and the medication to help you lose rather than you just try to push away from the table. So my message for diabetics is don't fight it. Use the technology. There's at least 5 new medications out in the last year, and really 90% of them have weight loss for diabetes. So I think really encourage the folks out there to get with their doctor. Get your A1C. Know what that number is. It's a diagnostic lab test to tell you what your report card is. And let's work on getting your weight down.
What I like about what you're saying is sustainability.
Correct.
So what we're not only trying to, we see a lot of diets where you look and you see somebody lose 100 pounds or what have you, and which is a lot. But they may lose 20, 30 pounds, and then you come back and they've put 50 back on. So I think sustainability. Got to ask you, gene therapy. And Dr. Marr, you and I talked about this before. This sounds like we're cutting on way new technology. Love for you to inform everyone what else going on here in the future now with Colonial Family. Dr. Marr?
Well, genetic therapy or genetic testing is about tailoring regimens to individual patients. We've got to get away from the one-size-fits-all. The genetic testing for different for variability crosses the span from medications to cancer treatment to tests for heart disease, heart attack. It crosses the span. One of a commercial I had seen earlier about Cancer Center Treatments of America, one of the things they do is they do a lot of genetic testing to look and see, are these the best treatments for the cancer that patient has? Again, it's like going into a clothing store and getting that suit tailored specifically to you, because everybody metabolizes medications differently. Everybody responds to medications differently.
Excellent, Chris. I found in a family member, one of my family members was taking a medicine called Plavix, which can make you bleed excessively. Well, how did I know that? Well, I did a DNA test on him and found that he could not take that. And we stopped him on it, and unfortunately, before he had any kind of complications and bleeding. We have a molecular flu test now, and I believe we're the only one in town doing this, and it's a DNA test for flu. And we've picked up a lot of that. The flu's very serious, and it can really kill you. So we encourage everybody, if you got fever and headache, to come get the molecular flu test. We have a test called Core CAD. It's actually a blood test to look at risk factors for heart disease. So just another leading-edge technology that we hope we're bringing to town. We hope all the doctors in town get it. We want everybody to have access to this technology because we think it does make a difference in people's lives. We also have advanced lipid testing, which is advanced cholesterol. In the old days, Jeff, me and you, it was LDL and HDL, good and bad cholesterol. It's gone way beyond that now. There's about 10 or 15 different cholesterol factors that go into somebody's risk profile to determine exactly what medication they need.
Wow.
It's really remarkable. And we've really, I think, had quite an impact on patients' lives with these tests. I can't help but think of a patient that our practice saw about 6 months ago. This patient was having chest pain, had a stress test done. The stress test came back normal. And we've all heard these stories. We've all heard these stories about that patient who had a normal stress test and then had a heart attack 3 months later. Well, what happened? Was the stress test wrong? What happened? Well, this patient had a normal stress test, was continuing to have pain, and one of the physicians at Colonial ordered a chorus test, which came back very high. At that point, that patient was sent to one of the cardiologists who catheterized the patient, and that patient ended up with a bypass surgery, meaning that blockage was not found with the traditional testing. It required some advanced testing that probably saved that person's life.
Incredible. Yo, we got probably 2 minutes left in this show, and just a wealth of knowledge. And I want to, again, tell us how we can reach you. Colonial Family Practice, we're in Sumter, we're in Manning, different locations, Broad Street, 220 Broad Street, I believe, Chris.
220 Broad Street, and Dr. Stewart, Judy, and Mar.
Yeah, Dr. Louder.
And we're at 325 Broad Street. And then we have our Colonial Neurology that's out on Westmark. We have Charlotte Greco, who actually does our HCG clinic. You can get her directly if you want to do HCG out at Westmark as well. We have our Colonial Pediatrics that's on Liberty Street, as well as on Bultmann Eye Center if you need some eye care.
That's wonderful. And the neurologist on Westmark, right. If I fell asleep when you said that, I didn't mean to. But, yeah. Tell us one thing you want everyone to take away from this show, Dr. Marr. Just one point that you feel. I'll give you mine for preventative medicine. Go see your doctor. If you're not seeing a doctor, go by, see your physicians at Colonial Family Practice. Let's get some of these tests done. I think we can prevent a lot of the problems that we've seen. That's what I've learned from this show. Dr. Louder, any closing comments that you'd like to leave with anyone?
Oh, man, the first closing comment I want to do is thank both of y'all, Derek and Jeff Reed. Man, y'all are Sumter guys. And I've enjoyed knowing you business relationships and friend and on the ball field for the last 20, 30 years. And y'all have invested in Sumter, and we want to thank y'all for doing that and for running businesses in Sumter and trying to value our community like we do. We love Sumter. We think it's a great place to raise a family, and it's a great place to live. And we are going to continue at Colonial Family Practice. We are going to continue to push for that and push for patients' lives and health. And we will see you today.
Very good. Well, I want to thank our sponsor, At Your Home Service. You can catch At Your Home Service on 1250 Wilson Hall Road. Phone number 803-607-9677. Again, designed to keep people out of the nursing homes as well with all of your medicine. Y'all, thank you so much today. I appreciate it.
Thanks,
Jeff.
We'll
back next week.
You guys are so good, you're going to put me out of a job.
Thank you, Derek. All right.
All right, you still got 30 seconds.
Oh, we have 30 seconds?
You have 30 seconds from right now.
Okay. Well, you know what? We asked Dr. Marr what he learned today, and he hasn't said anything. Dr. Marr, you have 22 seconds to tell us what you've learned today.
Well, again, prevention. Do what we can to keep you out of the hospital. We do what we can to keep you enjoying things, enjoying your life, being active.
Well, I want to thank you guys not only for the show, but what you do for the community and all the jobs that you have. You're a credit to the community. And thank you for showing up today.
Thank you.
We'll do it again.